All right, we will go ahead and get started. Welcome everybody to our Missouri Open Door Benefit Series for December. Today, we're going to be talking about benefit enrollment centers. And just as we start the meeting, there is no chat feature available, but there is a Q&A feature. If anything comes up as either I or Treva are presenting, feel free to go ahead and drop things in that Q&A, and we will answer those at the end of the presentation. Also, just want to point out that as always, this will be recorded and sent out and posted to our Charting the Life course YouTube at the end. Okay, so this series is sponsored by Medicare Improvements for Patients and Providers Act, or MIPA, Priorities 1, 2, and 3, which are the Missouri State Health Insurance Assistance Program, the Missouri Department of Health and Senior Services on behalf of the AAAs, and UMKC IHD as the No Wrong Door grantee for the state of Missouri. Okay, we have a couple announcements before we get started. Our 8th annual Charting the Life course showcase dates have been announced, which we're very excited for. In 2024, they're going to be April 23rd through 25th, and registration is open. I will go ahead and drop these links in the chat once I'm done with my section. The showcase, for those of you that aren't familiar, are an opportunity to share and learn about Charting the Life course principles, coming together and networking with advocates, families, and professionals, and exploring how Charting the Life course is used in all kinds of personal growth, community engagement, policy advancements, and technological innovations. I'll just show these really quickly, but again, drop these links in the chat. We have our call for presenters as well as our call for sponsors out. So if you're interested in either of those are open as well. We also have a quick announcement from one of our partners, Missouri Assistive Technology. Their Power Up conference dates are out. That's going to be April 8th and 9th in 2024. Registration is coming soon, but their call for presenters and exhibitors are live as well. And I'll drop that link in the chat too. From SHIP, Medicare open enrollment is still going on. Tomorrow is the last day. So if you have not gotten a chance to get around to that yet, really try to get in by tomorrow. And share with your networks for the last day. So just a little bit about Missouri No Wrong Door. Its goal is to transform the way people access services in the community. So supporting individuals and caregivers to make decisions on complete and accurate information about their options. And that's for anybody seeking long-term services and supports, regardless of their age, income, or disability. As we look how that fits in with our Open Door series, our goal with those is to open doors to integrated supports. So as you can see here, our goal with supports is to integrate service and supports options into a person's life. Sometimes when we have just eligibility specific options, it can keep a person from integrating in their family and their community. So we want to make sure that we look at all of our options when it comes to services and supports. Really briefly, personal strengths and assets is the top part of the star. That's skills, strengths, assets, anything a person is good at, anything that they have. The purple star part is the relationship part of the star, which is going to be family, friends, acquaintances, anybody that has access to help you. This green part down here is the eligibility specific part of the star, which is what we focus on in this benefit series. Those are any needs-based or eligibility specific government formal supports. The blue part down at the bottom is community-based, which are going to be places in the community, groups or memberships, anything local that anybody is going to have access to, regardless of any kind of eligibility. And then the last part is technology, which is going to be anywhere from everyday technology to adaptive and environmental technology, which we discuss more of that in our Missouri Open Door Technology series. For 2024, we are going to start both of our series again. So we'll have the benefit and the technology ones. Benefit series are going to be on the second Wednesday of every month. from 12:30 to 1:30, and the technology series are going to be on the fourth Wednesday of every month from 12:30 to 1:30. And then I will go ahead and pass over the screen. And Treva will talk about benefit enrollment centers.
Okay, that's working now, right? Okay, you see the benefit enrollment center, which now that I have it on the screen, I can actually figure out where I'm at. I work with Senior Age Area Agency on Aging. My name is Treva Warwick. I've actually worked for the agency for 28 years now in getting a paycheck. I worked for them 3 years before that doing volunteer income tax assistance, and they decided to keep me around for a little while. But just a little bit about what area agencies on aging in Missouri, and hopefully you can see that screen fairly well, but Missouri is divided up into 10 different regions for area agencies on aging. We are the purple right there, Southwest Senior Age Area Agency on Aging. We used to be Southwest Missouri Area Agency on Aging, but as you can see, they're all divided up into different regions. Some smaller. We have some have only 4 counties. We actually have 17 counties, and all of the area agencies on aging work together through the Missouri Association of Area Agencies on Aging. With that, which I wanted to share this map as part of showing the counties that are in the lowest poverty levels in Missouri. And if you can see right there, several of the counties that are in our region are some of the poorest counties in Missouri. Texas County, with 24.6% of the people living in poverty level. And I'm sure that all of you working with this already know what the federal poverty level, what that is. For a single person, it's if their income is $14,580 and below. For a couple, $19,720 and below. But for all of these counties, Shannon County, Oregon County, Howell County, Texas County, Ozark County, which is where I live, almost in Arkansas, but I'm still in Missouri. But they're all in the region as far as, you know, the counties with the most need. But yeah, back to the area agencies on aging. The area agencies on aging gets funding through the Older Americans Act, through a lot of different grants, the Missouri Department of Health and Senior Services, block grants, state and general revenue, Medicaid. Some counties have a senior tax fund that helps out. We also do this through client contributions. We have foundations that raise money for that. So the funding that comes through a lot of different grants besides the Older Americans Act. Right now, one of the things that I'm especially working on, we received the Navigator grant in the state. So that's one of the things that we spend a lot of time on too. Navigator grant, we do a lot of Medicare counseling. When I started with senior age 28 years ago, basically my training that day was the day I was hard. It was basically the back of the form. And my main question on that day was, what is the difference between Medicare and Medicaid? There were the Medicare savings programs and all that, but with Medicare, that was basically the only insurance. That and Medicaid, there were no Medicare Advantage plans. There were no Medicare prescription plans. No decisions as far as when you went on to Medicare about what plan you were going to be on. So seeing the difference and the confusion that a lot of people have with Medicare since then, I've kind of grown into that over the years with them. So we'll get back to the benefit enrollment centers. Across the state, there are 6 area agencies on aging that participate in our BEC grant. With those 6 agencies, that covers 69 counties in Missouri. In those 69 counties, there are 116 senior centers. I think I probably worded this a little different. There's more than 116 senior centers in Missouri, but that's of the ones that are operating in them with a benefit enrollment center grant. The benefit enrollment centers have a focus of 5 core benefits. Of course, we're looking at promoting lasting, innovative, systematic transformations to the ways in which seniors and adults living with disabilities are assisted in enrolling in and retaining public benefits for which they're eligible for. That comes, of course, from National Council on Aging. They stress 5 core benefits really with this grant, and with those, of course, we find they are the most important. There are a lot of other optional benefits, which we do screen for those, and some of those benefits vary by the county they live in. But the Part D low income subsidy, extra help, is one that we, of course, always screen for. The Medicare Savings Programs is a big program that we find a lot of people do qualify for, but really don't know about, confused about. The Supplemental Nutritional Assistance Program, SNAP, which I've always referred to it, and a lot of people my age and older, the food stamp program. Heating assistance, low income home energy assistance program, LIHEAP, of course, that's big right now. A lot of people qualify for that. Medicaid, still there. Optional benefits, which a lot of times is going to be their telephone benefits, extra benefits by county, perhaps food programs that are available in specific counties, but we go over more than just the 5 core benefits with all of them, which I'll show you here in just a bit. With the grant, in just the counties that are participating in this grant, have screened over 8,329 for benefits so far this year. Over 3,519 were assisted with applications for those benefits. We've conducted over 384 outreach events, and with those outreach events have actually reached 47,598 individuals. Now, this is on our BEC reporting for the grant. Actually, I would estimate that the senior centers have done much more than that. It's just, yeah, this is what's reported on our BEC working through this program. One of the things that I looked at as getting ready for this were the people that we were assisting through this benefits grant. And it was kind of surprising that over 44% of them considered that their health was only in fair to poor condition. So one of the things you can see right there, we're reaching the seniors that health-wise need this benefit besides financial. And their financial situation is possibly a factor in them being in only fair to poor health. Only 24% of them reported they were in good health. 7% very good health, and only 3% considered they were in excellent health. Of course, we are talking with seniors, but this is something that, you know, as far as how they rated their health, but very obvious there that the people that are financially in need are also, it affects their health. Very, very obvious with those numbers. Of course, the people that we help are below the federal poverty level. 52% of them were below the 20,000 annual income. There were only 6% of them that were veterans, and that's something that we find really in veterans. A lot of times they're going through VA for their benefits, so we're not seeing as many of the veterans. 77% of the people we assisted with an application were women, which is not surprising. 79% were age 65 and over. 75% of those that we assisted were living alone. Sorry, that's a typo. But they were either single, widowed, divorced, or separated, which that is kind of a given that we see a lot of people that one spouse has died, suddenly leaves them with approximately half of the income that they did have before. And one thing that a lot of people don't stop and think about is, even though their income has reduced to 50% or less than what they were getting, their bills are still the same. Their utility bill is not going to go down. Their vehicle expense is not going to go down. Their insurance, all of that, or rent, whatever their living expenses are. More than likely, their groceries will not go down considerably. So, yeah, when one spouse dies, leaves just one, there is that's shown in those numbers right there. Senior age, which I showed you that before, we do cover 17 counties in Southwest Missouri. In those 17 counties, we have 38 senior centers. It covers 10,000 square miles. We do cover each one of those senior centers with a care coordinator. Now, there may not be one specifically in that senior center every day. Some do travel between senior centers, especially in the rural area. But we do have a care coordinator that if someone comes in and they are in need of assistance or have questions, that we do have someone, a care coordinator in that area to help them out with that. Not only through the senior centers do we reach people. One of the ways that we find seniors that we do a lot of this screening for, and I suppose I put tax counseling for the elderly at the top of the list because that's how I first started through this program. But we do find a lot of seniors there that come in for free tax assistance. And while they're there, of course, we're going to be able to see what their income is, what their resources are, pretty much by what they bring in. So a lot of times as I'm doing someone's taxes, it is, did you realize that you might qualify for a Medicare savings program that the state will pay your Medicare premium for you? So a lot of times, through just them coming in for the income tax assistance, we find other programs. Our agency gives out the farmers market vouchers, which that starts in the spring, basically right after the income tax season. And of course, for the farmers market vouchers, they have to qualify income wise. A lot of our care coordinators, as they're going through that, of course, they're again screening. It's just kind of built in. When we see a senior, we are screening and asking them about income. I do have one care coordinator that I know of in particular, as she enrolls people in the farmers market. She's also telling them, based on your income, you would qualify for the heating assistance in the wintertime. If they haven't received that, they don't know anything about it, she actually keeps a list of those people and calls them back when it's time to apply, has them come back in. So needless to say, this time of the year, we've seen an increase in her LIHEAP applications just because she worked with farmers market. We do have new to Medicare classes, which a lot of times we're, of course, going over these benefits at that time too, besides just their options for new going on to Medicare. Medicare open enrollment, which we mentioned is going on right now. As people come in, switching plans, we're always screening them whether or not they qualify for the low income subsidy for the Part D plan. Of course, our senior centers, a lot of seniors are coming in there, but that's pretty much where a care coordinator is going to meet with clients. The Medicaid meals, those that are served through the senior centers and receive the home delivered Medicaid meals. Of course, we're going to be screening them to see if they get any property tax refund, if they're getting the LIHEAP, any other programs. We do get a lot of referrals from Family Support Division. If someone is in need, we do get referrals from them. They send them from there to the senior centers for help. Probably one of our biggest ways to find seniors is just word of mouth. If someone else has received help there, of course, they're going to refer someone else for the extra help. We get a lot of our referrals here in the counties that I work in from our county collector, our assessor, as they see people coming in and they're having difficulty paying their property taxes, or they're asking about, you know, well, they're a senior, if there's any discount. Of course, they refer them to us for that. That goes into our tax counseling for the elderly. But yet, as always, when they come in, we're screening them for all other benefits too. And I'm not sure if everyone can see that very well, and it may just be me. But this is one of the tools that we use with every customer that comes in. And it's something that Senior Age has developed as far as gathering information. But as you can see right there, it has a quick list of a lot of programs that our seniors qualify for. And this is a tool that we use for screening. This has changed over the years, but when I told you my training the first day was basically from one page, and this is the page that it was. It's changed a little bit again. It actually has a few more than when I first started, but on the back of that, this is something that at some senior centers, the senior will actually fill out whether or not they are receiving that, or if they have questions about it. But it's also a good tool for when we have the senior right there, is to take a quick look at what they might qualify for. One of the things that I do routinely on that, which is, as you're visiting with seniors, they're not always sharing about what they have as far as resources, money in the bank. And of course, a lot of these programs are based on resources. If a single person has over 16,660, then they're not going to qualify for the low income subsidy, extra help on the prescription plan. So that is one of the programs that has the highest resource limit. So if I have someone who's a little reluctant to share what their resources are, and I don't push that, but, you know, explain why I'm asking it. But a lot of times I will just ask them and show them this form this is one of the programs that has the highest resource limit, you know, and if you can tell me if you are above or below this resource limit, you know, if you're above this resource limit, that's really all I need to know. I'm not trying to pry into their business. But if they are that or below, then there are some programs that might help them out. So that's a good way to show them as far as why I'm asking that question. And really, I get very little resistance on that in the way that we go about that, instead of just sitting down and asking a form and saying, okay, and how much do you have in bank accounts and all that. They're not going to want to share that information as much. From that, of course, we go to the Medicare savings programs, and we have the difference in there as far as what the income is between for a single person, a married couple, and then their resource limits as well. With that, that's something that we do find a lot of people qualify for and are not aware of it, because the resource limit is higher than what people think that it's going to be. People are still have have it set that in order to qualify for Medicaid, you have to have less than $1,000. So a lot of people are still looking at that as far as an income limit. So screening them and letting them know that. Now I have a lot of people who are maybe just over that, just kind of barely on the edge. So letting them know in advance is, hey, if you do have something and you do get down to this level of resource, come back in and see me. We don't want you to spend down to less than $1,000 before you ask for assistance on this. And again, I like this page because, like I said, this was my training the first day. This was it. This was all we had. There was no internet chart to go to, anything else on that. Besides the one page, we have created a larger benefit chart, and this is a full 12 pages with a lot of extra benefits that people qualify for if we really want to stop and dig in. And with that too, actually tells how to apply for the benefit, gives the website to go to, more details. Of course, we're going to give the income resource guidelines for each one of those, but having the extra notes out here and where to apply to, even I forget once in a while, and some of these are newer programs that I'm not as familiar with. So having that available, and especially for our newer care coordinators, but it's very, very helpful to go through that. And a lot of times, you find yourself just actually going through the 12 pages to make sure there's not a benefit that we've missed on that. We do have brochures, and this is the page of some of those that we do in our outreach as far as passing out to people. We put them out at various places for people to pick up, not only at senior centers, but post office, family services, any place like that. It is difficult to keep it updated as far as income resources, all of that, but it's a constant changing thing. But we do have that we keep available to hand out for outreach. And then our second page of that gives all the information. And with this, we do have a lot of people who pick these up and will call in from that. So besides all of that, with the screening that we do and the tools that we have, the National Council on Aging also has a web page you can go to, and we'll go to that in just a second here, but this is what the web page looks like. I can't go to it from here to actually browse all their benefit programs. So are there any questions before we go on to look at that? The 12-page benefit information, I can definitely share that with you. It's something that we pretty much use in-house. So we don't send that out as far as giving it to a lot of different people because, well, the information on it, may not be up to date all the time, although we do update very frequently on it because it is an in-house form that we have. So this is on the National Council on Aging. Again, that is who funds our Benefit Enrollment Center grant. And they do have a site there where you can go to actually look up a lot more benefits than what we possibly even cover. The zip code I got in there right now is actually for Gainesville, which is in Ozark County, but it's going to show as maybe not as many benefits as some of the others, but a lot of the people that we meet with and that we see, especially in our rural area and those with the lower poverty level, a lot of those do not have internet access. A lot of those do not have capability. Even if they did have internet access, they do not do not operate a computer, do not understand all of that. So this is not something that we use a lot with our seniors as we're screening them. But it is definitely something that we can go to. A lot of more benefits here. So on that, you can, with this type of benefit, you can screen specifically if someone is only looking for housing assistance, if they're only looking for wanting extra income, employment training, disability, long-term care, discounts and activities for national parks, state park discounts, of course, legal aid, veterans programs. For this one, I'm just going to select all. And hopefully my internet is working okay today. I did get a message yesterday that they had something down, and I didn't think about that before we went on today, but it seems to be working okay. Okay, so for healthcare, screening for healthcare and medication benefits, it shows there's 4 different programs. Go through a screening for Medicaid, Missouri Health Net. The program phone number right there, I do know this phone number is our local family support division, which they will take an application. There's really at our local office where this number is right now, they really do only Medicaid vendor application is basically what they work with here, but you can take an application there. Again, most usually if someone goes out there looking for benefits, needing help, a lot of times they will refer them back to our senior center. The extra help, low income subsidy for the prescription program. And of course, this is going to be the Social Security number. Also, you can go right there to apply online for that. Applying online is pretty easy, fast, simple to go through on that. Linet, Medicare program, which we don't see a lot, but it's those who are on extra help and they don't already have, they're not already signed into a prescription plan to go through that. Medicare savings programs, and of course we covered that, but that is again our family support division, their number there, and this will take to show the different programs there. Again, you know, a lot of our seniors, we have tried using this, and a lot of our seniors not familiar with computer, not able to do that themselves. They tend to just come to the senior center and want someone to tell them how to do it, or actually complete the application for them. The low income home energy assistance program, LIHEAP, again, for this area, it's going to refer to Ozark Action, which is where they're applying for here. And of course, I kind of know most of these phone numbers by heart. Housing vouchers, of course, to USDA for that. HUD, it does give a lot of that. Lifeline is a discount that especially when I first started that I kind of stumbled onto that found out that anyone who was on any of these extra help programs could get a discount on their home telephone bill. At that time, did not have the cell phone bills. And I know I'm kind of dating myself there because, yeah, I go back a long ways. But the Lifeline discount was something that I enrolled a lot of people in when I started after I discovered this program. Would give them a discount on their home telephone bill, their landline, which in the rural counties, which I still see that quite a bit, a lot of people still do have their landlines because where they live, they do not get cell phone service. And it's just something they're familiar with. They keep their landline phone. Now, a lot of our seniors are switching over to only cell phones, and of course, we do have a Lifeline discount can do that for cell phones and help them out with that. One of the things that I discovered in Douglas County when I first discovered that this Lifeline discount was available, discovered that a lot of people were being charged twice for their in-home maintenance fee on their telephone bill. The telephone company had switched companies, and they had two different charges on there. One was for one company, one was for the other. So they were actually getting double bill for that. We were able to help a lot of those people get a refund back up to 12 months of the extra charges that they had done on that. But again, we're going back a few years on that. So aging in place, again, going through Medicaid, Missouri Care Options, and that is if they stay in their home, instead of moving to the nursing home, having someone care for them on a daily basis. And of course, through our senior centers and the programs that we promote and try to help people, one of our main objectives through the senior centers is keeping seniors in their home and healthy. I mean, it's proven that it is cheaper to provide some extra services for them to stay in their home versus going into a nursing home. So it's definitely something that we work with daily on that. But it is what our area agencies on aging are based on, is keeping the senior living in their home for as long as possible and living there safely. Transportation services, and that does give phone number for that. I believe that should be our local area agency on aging, although they do have one number off there. I probably need to notify them on that. But transportation services, that's going to be through the Oats bus, basically in our rural area. Transportation for rural areas is a huge issue and something that does need some extra help. Anyone looking for work, again, it shows different areas that they can go to. Pension help. Anyone who is looking for a job, and we do have a lot of those through the senior centers there that are working for that. Unless someone has some questions on that, I think really, going to this website and just exploring and what all is available there. I don't think, we could go through a lot of different scenarios, but it's basically, you're looking it up for a specific area, a specific person, and going through that. There are a lot of different options unless you put in there specifically what a person is looking for. So any questions, anything on that? I really don't have a whole lot more on that unless you have some questions.
So I just went ahead and sent the link to the benefits checkup website in the chat so that everybody
Okay.
has a direct link to it.
Right. Thank you.
We will go ahead and give it another couple of minutes and see if anybody has any questions. If you aren't able to put it in the Q&A, if anybody wants to raise their hand and ask a question, that's an option as well. Otherwise, this session will be recorded and posted to the Charting the Life course YouTube, as well as sent out to anybody that registered today once the recording is available. And Triva's email is in the chat, and I will go ahead and place mine as well. So it looks like we have a question that just came in the chat. How can you find assistance to stay home if you are an older adult and do not have Medicaid, but do have Medicare?
Yeah, and with that, there are programs that will help out for someone to stay at home. A lot of times that's going to go through the doctor, through Medicare, whether or not they are available. A lot of the programs that we have for someone who wants to stay in their home, of course, is assisted living technology, as far as, making sure they have the handrails, the walkers. There is a program that we screen people for too, the home and community-based services. And a lot of times, if it's a married couple, they can do a division of assets. The home and community-based services is one that a lot of people do use, and is being used for people to stay in their home. They have a higher income guideline and a little bit higher resource benefit. Of course, in order to qualify for that, there has to be a need, and basically, which there is an assessment, call to get an assessment done. Like I said, they have a division of assets. They have to complete a Medicaid application to show income and resources. But the home and community-based services is definitely something on that. One of the things, of course, they can qualify to get meals at home. There is also housekeeping that's available in all counties. Now, in some counties, there's a waiting list. Of course, there's not as much funding, but in a lot of the counties that have their own senior tax fund, there's a lot more benefits available in those counties as far as keeping people in the home. A lot of our counties that have a senior tax fund will actually, excuse me, pay for a life alert device. And again, that's something, keeping the senior in the home, and yet if they fall something on that, they have something to get a hold of someone. So a lot of devices out there available for that. So if that is something that, someone contacts us and they are feeling like, they're insecure at home and feeling the need to go to a nursing home, a lot of times that may be their only choice, depending on their health. But we do cover all other options as far as keeping them safe and keeping them in their home, providing housekeeping services, anything we can do on that to keep them at home.
Yeah, it's not looking like we've had anything else come in.
Okay.
Are there any final questions before we go ahead and wrap up for today? You can go ahead and drop those in now. Okay. With that, then I will just say thank you, Treva, and thank you for everybody who has joined us today. Both of our emails are now in the chat if you have any additional questions that you need help answered offline. And be on the lookout for an email with the link for this, as well as registration coming out for January series. Thank you, everyone.
Yes, thank you, Angela. I appreciate it.